Hi, everyone. You're welcome. Welcome to Nursiscope Career Bootcamp 1.0. Can you all hear me? Please let's indicate in the chat box if you can hear me. Okay, you're welcome. And let me know where you are connecting from. You can just put your name in the chat box and where you are connecting from. I'd say you can help us display on the screen so that we can know where our participants are connecting from. So you can share the live, you can share on your Facebook, on your WhatsApp status that the long anticipated Nursiscope Career Bootcamp 1.0 is underway. Right. Okay. Thank you so much for connecting. Thank you so much for dropping that. All right, that's great. So you can hear me. I'm saying, okay, good evening, Esther Adeshino. Good evening, Enyade Florence. Amida Gbadamosi is joining us live from Nigeria. Esther Adeshino to joining us from Nigeria. Thank you so much for connecting. I can see Ifeoluwa Ajayi saying good evening. You are welcome. Odetta Yoyomide, good evening. We have a lot of participants joining us from Nigeria. And I know we have a lot also connecting from Canada, from the US, from the UK. Just let us know where you are connecting from. Thank you. Oh, this bootcamp is going to be a very wonderful session. 2 months of transformation, March to April. 8 weeks of transformation in our careers, 8 weeks of clarity. Good evening, Chinyere from New Zealand. Wow, that's a long way you've come from. You're welcome. Odetayo Ayomide from Nigeria. Thank you so much for connecting. Chidima from Lagos. You are welcome. Wow. I love the energy I'm getting in the room. Okay, beautiful. So we are starting right away. Apologies that we didn't start on the dots of 1 p.m. here in Canada. We had some technical issues we are trying to fix. We're glad we have been able to fix them. Ugo from Edmonton, Canada. Wow, you are welcome from Edmonton. I'm connecting from Halifax here in Canada. It's nice to see folks from Canada joining. Akinleya Igbemisola, you are also welcome. Thank you so much, everyone, for connecting. So you are welcome to the Nursiscope Career Bootcamp 1.0. It is with great excitement and pride that we open this unique learning experience to you. Nursing is no longer just about patient care. It's about leadership. It's about innovation. It's about research and creating impact beyond the bedside. This bootcamp has been designed to equip you with the knowledge, with the skills, with the confidence you need to navigate your career in today's dynamic healthcare environment. Over the next 2 months, you'll be engaging with experienced nurse leaders, researchers, innovators, and educators from all around the world. You will explore areas like research, data analysis, nursing, entrepreneurship, branding, and communication. And each track has been carefully structured to help you move from uncertainty to clarity, from potential to positioning, and from learning to doing. This is not just a training, it is an opportunity to reflect on your career, identify your strengths, and take practical steps to achieve the next level of success. We encourage you to participate actively, network with peers, challenge yourself, and apply what you are going to be learning. Your growth and development are the art of everything we do at Nursiscope, and we are committed to ensuring that this bootcamp is transformational and practical. We are thrilled to have you on this journey, and we cannot wait to see the impact you will make in your career and the wider nursing profession. Let's embrace this opportunity and make the next 2 months truly count. Once again, you are welcome. My name is Oluwadamilare Akingbade, the CEO and founder of Nursiscope Incorporated, and I'm glad to welcome you on board. Let's type on the chat box. I'm sure we are seeing different names. Just welcome someone in the chat box. Obafemi Precious from Ondo State, Nigeria, you are welcome. Jafet, you are welcome. We are really excited. Oladende Tobiloba, you are welcome, and we are excited to have you on board. We are honored to have Dr. Jose Arnold here with us today, and I've been following his profile, his LinkedIn for a while, and I've been really inspired. If there is anyone that has inspired me in my journey, that is Dr. Arnold, and I'm so sure you are going to be inspired today as it takes us on a very inspiring journey through his career and helping us understand how we can position ourselves for local and global impact. Oh, we are also having Adiola from Halifax. Wow, uh, you are most welcome. Okay, so let me welcome Dr. Joseph by reading his bio, and then we can have him on board.
Thank you so much, Dr. Dami, for having me. Let me just share my screen.
Okay, before you share, can I please let me read your bio? So,
Okay, sure.
okay, thank you. So they can know more about you. So Dr. Jose Arnold Tariga is a nurse educator, nursing professional development leader, and advocate for workforce sustainability with over 17 years of experience across the Philippines, the Middle East, and the United States. An internationally educated nurse, Dr. Arnold focuses on helping nurses navigate professional transitions while strengthening workforce integration, competency development, and long term retention. He is the founder of Bridge and Beyond Advisory, a coaching and consulting company that partners with nurses and healthcare organizations to turn transition into transformation. Dr. Arnold currently serves as a hospital clinical educator within the Encompass Health System, the largest post-acute rehabilitation provider in the United States, where it supports clinical excellence through competency-based education, professional development, and evidence-based practice. He has designed and led simulation-based and competency-driven programs that prepare nurses to succeed in new healthcare systems and evolving roles. His work blends lived experience with evidence based practice while offering practical guidance grounded in empathy, cultural awareness, and professional integrity. Dr. Arnold is a top 10 finalist for the 2025 Aster Guardians Global Nursing Award, a fellow of the New York Academy of Medicine, and a fellow of the Faculty of Nursing and Midwifery at the Royal College of Surgeons in Ireland. He is also the recipient of the ANPD Partner for Practice Transitions Award and a Harvard Medical School Capstone Award winner. He is the author of Building the Bridge, a journey of courage, growth, and transformation, which introduces the bridge model, a framework inspired by his own migration journey that guides nurses through adaptation, integration, leadership development, and long term empowerment. A sought after speaker, Dr. Arnold regularly delivers presentations on nurse transition, leadership development, and global nursing education while engaging a global audience of more than 40,000 LinkedIn followers. With a clapping ovation, shall we welcome Dr. Josie Arnold Tariga. You are welcome, Dr. Arnold. You can please share your screen.
Thank you so much, Dr. Dami, for that very kind introduction. And I'm going to be sharing my screen now, and I hope everyone can see it. So just wanted to verify that everyone can see my screen. Okay, so Dr. Dami, just let me know. But while we are waiting for the screen to show up, if it's still not showing up in your screens, I just would like to say thank you so much, everyone. Good morning, good afternoon, and good evening, everyone. I can see from the comments and the chats earlier that we are very global today. And I am so grateful that many of us nurses, I know wherever you are in the world right now, thank you so much for taking the time to be here with us today and to actually participate in this 2-month boot camp for that is being provided by Nursiscope. And the fact that you are here today actually showcases your interest to further your careers and to find a better opportunity for you in the future. So I'm so excited and I'm so privileged to actually be here and to be among the lineups of great speakers over the next 2 months. So I hope that all of you are going to continue participating in the upcoming presentations that will be provided by Nursescope. But before, of course, anything else, I would like to extend my sincere gratitude to Nursescope, Dr. Dami, and the organizing committee for letting me be part of this program. Because as an international nurse myself, who has transitioned into different parts of the globe, different careers throughout my 17 years of nursing experience, I am so passionate in terms of sharing what I know and some strategies on how I sort of survived the transitions all throughout. Because I would presume that as many of you, because I think like many of you have have transitioned as well, maybe from your home countries, or if you are if you are at your home country right now, you must have transitioned from one career level to another. So if you have not done that yet, it's important for us to understand that there can be struggles, there can be challenges, there can be obstacles when you are moving around the landscape of nursing. So thank you so much for being here with us today. And I also just want to have a disclaimer that even if I'm here, even if I'm talking to you right now, I'm sharing my experience, my the strategies that I've used during my transition, I also just would like to have a disclaimer that I am not an expert of everything. And I think like that's one thing that we have to keep in mind as nurses, because the tendency is that if we think that we are so good at everything, chances are you might stop learning and you might stop seeking and being curious about what is out there. So always have that mindset of being curious about what could be possibly out there, as a nurse, because there's definitely a lot of pathways there that you can take as a nurse. So Dr. Dami just wanted to check in if
Yeah, so I've been checking. You can maybe stop sharing and then reshare.
there. No problem.
Okay.
Of course. Let me try this again and see if this will work.
Yes, we can see now. We
You
can
can
see.
see now. Okay.
Yeah.
Oh, can you I think like this the different slide. It's not moving from my end. Um, stop sharing again.
Okay, you can stop and reshare.
Okay. Um, so thank you so much, everyone, for your patience. As much as we love technology, sometimes it does give us some issues.
Yeah,
How about that, Dr. Dami? Can you see my screen now?
it's coming up. Yeah, it's up now.
Okay. So okay, we're glad that that is sorted. Okay, so for this session, for this opening session for the boot camp, as I said, I will be sharing some insights on how you can navigate your nursing career, because you might have noticed that over the last few years, there has been a rapid transition and evolution of healthcare, and with the evolution of healthcare, of course, like there is also an evolution of how nursing is being done. It could be differences in terms of nursing practice in your home country, or like if you have transitioned or has moved across the globe. I'm sure that there are changes that is happening as we speak. Like what could be true today or what could be true 5 years ago might not be true today anymore, especially after the COVID pandemic, right? So there has definitely been a lot of changes. And many of these changes are really for the good. Some are a bit challenging, but I guess like with the challenges that we've encountered, we've learned that there is more to nursing. And I think like in terms of the landscape of nursing, like even now, we are now actively talking about artificial intelligence, telehealth, things that we might not have been talking about if COVID did not happen. So um, my goal for this talk is simply not to just talk about or share about my story, but to really share the lessons that I've learned from my journey, which I'm going to be sharing shortly, and also introduce a framework that I hope will help guide you as you navigate your transition, whether that be from your home country to another country or from one role to another, whether from the bedside going to leadership roles or other roles. And our goal really, I would, the goal really for this bootcamp is to make sure that you progress from the old version of yourself to the next version of yourself. And hopefully that version is, a better version of you. Okay. So for those who are with us right now, I would like to ask, and I'd like to begin with a simple question. Have you ever asked yourself and or whether where your nursing career is going? Have you had that pause in your day or in your life and ask yourself where your nursing career is actually going? And really, not just what about your next shift looks like or what your next job might be. Really asking yourself where your career as a nurse is headed in the long term. Because many of us, and when I was a young nurse, when I graduated in 2008, um, at that time my goal was really to just find a job, work in a hospital, find a job, and I didn't really think about the long-term plan for my career path. um, so I never even asked this question up until most recently, once I started exploring other pathways that I could do as a nurse. And it can be a bit challenging if we don't actually ask ourselves about whether where we want to go or where our career is headed, because the chances are we just tend to accept whatever we have on hand. And it's not wrong. I'm not saying that, like it's not okay to be contented, because it is. But what I want to say is that nursing, especially nowadays, is not just limited to the bedside. There are a lot of things that you can do um, when you are a nurse. And I guess like that's the beauty of nursing, right? Like you are not limited to just doing one thing. There are a lot of options that you can do, and that's why it's very important for us to ask intentionally, how are we shaping our careers? Are we intentionally shaping it? Or are we simply responding to whatever opportunity or challenge that appears next? Or are we trying to find ways on moving to the next step? There was a research that was conducted by Hall and Chandler, and according to their study, they found out that individuals who engage in intentional career planning experience higher professional satisfaction, stronger identity formation, and greater long-term career mobility. And the fact of the matter is that, again, if you as a nurse know what you want to do with your profession, what you want to do with your career, chances are you're not just going to come to work for the sake of working, but you will come to work for the sake of loving what you do. And how amazing would that be, right? Like, if you are doing something that you enjoy doing, that does not stress you out. Because can you imagine, I'm sure that at one point, whether you're a nurse or as a professional, whenever you are doing something that you do not enjoy doing, sometimes it can be so stressful. Sometimes you will not have the motivation to actually perform it. And the reality is that, when we went into nursing school, and I can really attest to this, when I was doing my nursing course before, like, we were never really taught in terms of how do we plan for our careers. I'm sure that there was like maybe a subject, during my 4 years of nursing, maybe there was just like maybe one subject that tells us that, oh yeah, when you're a nurse, you can be an educator, you can be a leader, you can be a manager or something like that. But there wasn't really like a class on like, how do you get there, right? And this is the reason why many of us, especially in and I can only speak about my experience in my home country, right? So I'm originally from the Philippines. When I graduated in nursing, like, my vision in terms of what path should I take next was quite limited, for the reason that I didn't also see that there's a lot of pathways that can lead me to somewhere, right? And eventually, when I started reading and researching about stuff, I've realized that, oh, in some other countries there's actually more pathways there. There are areas that I can subspecialize as a nurse. And that's I that's really the goal for this boot camp, for us to really understand and to really explore um, what are the opportunities for us as nurses, right? Like, because again, like, we don't want you to be limited with what you currently have right now. We don't want you to have that limited mindset of like, I'm just a nurse. This is a very common phrase sometimes that I hear, and I really don't like that phrase, because we are not just nurses. We are nurses, and we are so capable of doing a lot of things beyond working the bedside. Okay, so just to share about my journey, as I said, I was born and raised in the Philippines. Um, it's quite funny because this is a true story. Like, I never really wanted to become a nurse initially. So I wanted to become an educator or a teacher back home. But then um, during my senior high school year, many of my friends who have relatives abroad said that, oh, like, it would be nice for you to take up nursing, because like that's one way for you to move abroad. And true enough, like, I've seen a lot of people, a lot of Filipino nurses, after a few years of working back home, they migrated to the US, to the United Kingdom, to Canada, New Zealand, Australia, these big Western countries. And so I was like, okay, maybe I will give it a try. And one of the main reasons, and if I have to be very honest, like, one of the main reasons why I really took up nursing was because I was born from a poor family, and my friends and the relatives of my friends who have moved abroad said that, like, if you work as a nurse abroad, you're gonna get a good amount of money. It, bottom line is, like, it helps you to become financially stable, and that was really the goal. I wanted to help myself, and I wanted to help my family as well back home. And so I decided to, well, I spoke to my parents first, so that, I will be assured that they can support me financially. And so they said, like, like, yeah, let's do it. We will work hard to support you. And so I enrolled in nursing school, and I started in nursing school in 2004. Um, and I'm telling you, I hated nursing initially. Uh, I hate needles. That's a fact. I hated needles before. I still hate them now. I just don't, I just don't want to be poked. But there was something that changed my perspective about how nursing is when I was in nursing school. In my second year, that was when we started having our clinical exposure, and in the province where I lived in the Philippines, like, we really had a lot of um, poorer community, and many people did not have access to healthcare. And so I saw how impactful the work of nurses are in hospitals, providing care for people who could not afford um, healthcare, and like the nurses just being there for them, trying to do their best to make sure that even with those limited resources that they have, they were able to provide proper care. And so, even if I hated nursing initially, I decided to like continue doing nursing school because of that shift in perspective. So, long story short, after 2008, I graduated as a nurse, and after graduation, I've worked there as a med surg nurse in the Philippines, and then eventually I moved into critical care. So I was there. I was there in the Philippines working as an ICU nurse for almost, I would say, maybe around 3 to 4 years, and my sole focus at that time as a nurse was really to just become, like the best nurse, a good critical care nurse, very competent, make sure that I provide the highest quality of care for my patient, make sure that I work well with my team to ensure that our patients are safe. And I really never thought of going up the ladder. At one point, because like there was a fast turnaround of nurses during my time. After I think after a year and a half, I was promoted as a nurse supervisor or a head nurse in the unit, and then it went up. You become a preceptor, and sometimes did some teaching and stuff. And eventually, and this is still a sad reality back home, I realized that the money that I'm earning from working as a nurse back home was really not enough. And so I decided to look for opportunities and move abroad. So I took my backpack and my luggage, and I decided to fly to the Middle East. So when I think it was in 2013. In 2013, I landed in the United Arab Emirates. I started working there as a bedside nurse, working with long-term ventilated patient. So, I was able to use my experience as an ICU nurse back home. But most of our patients are really bedbound and are unable to move on their own. So, like, there's a lot of therapy, a rehabilitation, therapy, and medical and nursing care provided to the patient. So, during my experience there, it was an eye opener because like it has really opened my eyes, and it has really changed my perspective in terms of the need to adapt. Because the United Arab Emirates, for those who have worked in the Middle East, and I guess for those of us who have worked internationally, you will see that international healthcare systems are really very multicultural and multinational. So like there's a need for you to adapt and integrate during the transition, because you're not just basically adapting and integrating to the culture of that country and the patients, you're also adapting to the culture and the dynamics of your team, because you will have teams from different parts of the globe. So when I was in the Middle East, I was working with nurses from, of course, there were a lot of nurses from the Philippines, a lot of nurses from South Africa, from the neighboring Gulf countries like Jordan, Saudi Arabia, nurses from the UK and from Europe, nurses from Australia. So like really like it was very multicultural and multinational. I worked there for almost 10 years, and eventually, wait, there you go. That's the United Arab Emirates flag. Eventually, I realized that there are certain limitations while working there too. So I started talking to my friends who have moved into some Western countries, and they said, like, maybe it might be worth trying to move to another country since you've already started, migrating and trying other healthcare systems. So I decided to work on my NCLEX for the United States. And in 2022, I landed a job here in Massachusetts, in Boston. And just as a step back, while I was in the Middle East, over those 10 years, I've also transitioned into different roles. So there was a lot of transition and integration and navigation that happened all throughout my 17 years of nursing experience. So it was not just about navigating my home country from the Philippines to the Middle East and now here in the States, but really also navigating different dynamics. And I've learned a lot of things. Like one of the main things that I've really learned, or I have to relearn, was documentation. So as a nurse back home in the Philippines, and I think like it's still true to date, that not many hospitals back home are using electronic medical recording system. When I transitioned into the Middle East, they have a different process of documenting. When I moved to the United States, we are using electronic medical recording systems, and that is so integrated into your healthcare delivery and service. And um, that was quite challenging for me because when you're moving from one system to another, sometimes it's tough to adjust, right? And I feel like many of us who have moved to different countries can really relate on the challenges of documentation. Team dynamics was one of the things that I had to relearn. Of course, like when I was in the Philippines, because we have the same cultures, mostly the same religion, so it was easy. Like you want to go out after work, you go to church, for example, because most of us were Christians. Like if there are like cultural or religious celebrations, we do it together, mostly as a team. So it was very different. But then when I moved to the Middle East, I had to relearn how to work with a team, because then I have people with different religions, different beliefs and stuff, and I have to be respectful. I have to have cultural humility and understand that my culture is different from yours, different from theirs, and therefore, how can I find that sweet spot of like making sure that I work with them in a harmonious manner, without compromising my beliefs as well, right? And one of the things that I always say that I had to relearn is like how to adapt to the weather. Like it might seem so simple, but I come from the Philippines, and the Philippines is very tropical. When I moved to the Middle East, it's the desert, so it's mostly hot weather all the time. And then when I moved to Boston in Massachusetts, it's very cold during winter. And in fact, like we had the coldest winter this year. Um, and this was like, since I moved here in 2022, like this has been the worst winter that I've experienced here in the States. So I'm still trying to survive the winter storms and all this type of stuff. So I know that many of you can relate that when you are transitioning and when you are moving, there are a lot of things that you have to relearn. And it's just not relearning, it's also unlearning some of the things, right? Because as much as, for example, you are a skilled nurse or you're an experienced person, some of the things that you might have learned might not be applicable to the new environment that you have moved on. So let's say, for example, in the Philippines, because we don't have a lot of resources, we try to save up a lot of the consumables or stocks of equipment that we are using with patients, or yeah. But here in the States, for example, if it says that it's one use discard, you have to discard it because that is practice and that is safe for the patient. So again, when you are moving, when you are transitioning, there's a lot of things to consider and you have to relearn. So I want everyone to participate in this Mentimeter because I want this to be as engaging, and I don't want me to just be talking on my own. I want all of us who are here today, if you have an extra phone, if you're watching this on a laptop, um, I would like to ask you, where are you in your nursing career right now? So if you have an extra phone, kindly scan the QR code. If you don't have, you can open a web page, go to www.menti.com, and then use the code 7941053. Again, try this code and then let me know, where are you in your nursing career right now? What are you doing as a nurse? Okay, so we have a faculty in a university. That's well done. And I'm sure like it took a lot of effort to get there, because it's not easy to get hired as a faculty in university. Um, or, like, whether are you an early career nurse? Did you just graduate? Are you a mid-career nurse when you've worked for quite some time already? And, there has been a lot of changes all throughout. So let's wait for a bit. Let's see. Okay. A nurse intern. Okay. Thank you. So I'm just going to wait for responses. We have an early stage nurse. We have interns. So I'm just going to wait for some more. And maybe like some of you are even in, yeah, some are still in college, right? And still trying to find their footing in nursing. And I'm telling you, when I was still in nursing school, I have seen a lot of things that has really changed my perspective and in a way has changed my view on what nursing is and what do I want to do when I graduate. Because before, like I think like one of the things that I can remember when I was still in nursing studies, like I don't think I will survive the emergency department because it's just too much. Like there's a lot of like let's say there's patients from accidents and emergencies and stuff like that. All the family members are very emotional. So for me, like that's so chaotic. So sometimes like I was like, I might need to find a place in healthcare that is a bit toned down and quiet, and I can do my stuff. And I guess like that helped me in a way to decide to move to the intensive care unit. So um, whatever you are, wherever you are in your nursing career right now, I want you to have an open mind that yes, you might be doing that. You might be doing what you are doing right now, um, but it does not necessarily mean as well that that's going to be the thing that you're going to be doing in the future. And I'm not saying that like you should always aim to like move from one place to another, but what I'm trying to say is that wherever you are right now, just have an open mind that things can still change in your path. So always make sure that you welcome different experiences, and if you're able to network with some other people, welcome those networks. Try to ask questions, try to be curious, and try to think about the possibility of really expanding from where you're right now and becoming that next version of you. Okay, so we have mid-career nurses, we have ICU student nurses, postgraduate, post-basic nursing. Okay, so thank you so much for your participation. I'm gonna move to the next slide. So in terms of career landscape, as I said, like we can have different careers in nursing, and I guess that is again like the beauty of nursing as a profession. I never would have thought that I will be where I am right now in my career, because when I was a young nurse, I really have a very rigid pathway. And I'm this person who actually writes my goals. And in fact, like I have a goal somewhere posted near the mirror so that every day I see that, okay, this is what I want to do in the next 5 to 10 years. And if you're not that person, that's also okay. But I really would highly recommend for you to, maybe start reflecting on like what you want to do. And if possible, and at least for me, this is for me, it really does help me to have a note of something that I can see, so that when things start becoming so chaotic, and I know that some of us have families, or some of us have overlapping priorities. We can easily get dissuaded, or we can easily get distracted from all these priorities, and sometimes you forget about your goals. So it's always helpful to have something written, or something visible that will remind you that, okay, Arnold, this is your plan for the next 5 to 10 years. And as much as it's not assurance, it's not an assurance that you will achieve these goals, but at least you know that, okay, this is what I aim to have. So in terms of career landscape, many of us, usually in the nursing pathway, what my experience is, we always start as clinical nurses. Although I know that nowadays, because there's really a lot of subspecialties, and I can speak for the United States, there's really a lot of specialties that you can go into. Some nurses, based on my conversations with some new graduates, some of them would usually go into a specific subspecialty, and that's okay. If there's that opportunity for you to move into something that's very specific to the niche that you'd like to pursue, well and good. But generally, and maybe because like, so I'm a millennial, like the older side of millennials, I always believe that as a nurse, it's always good to start at the bedside. Having the clinical experience, having the experience of working with patients, working with family members, working with a team, a multidisciplinary team, in providing your care. it really gives you an opportunity to develop yourself as a nurse, not just from the competent side of it, but really from the empathic side of it, um, the human side of nursing, and all the skills, and the critical thinking side of it too, right? Because like you're going to be managing patients who might have difficult conditions and stuff like that. And the great thing about learning things from the clinical side of it, everything that you will learn there are actually transferable skills, which you can then utilize wherever you go. Um, I am so blessed and I'm so grateful that I was able to work in an intensive care unit because I've worked with a lot of critical care patients. I've worked with a lot of amazing team members, both nurses, physicians, and all the team members that you can work with. And I've learned a lot from that experience. And all the things that I've learned there, like for example, as an educator now, because when I was in the ICU, I had to learn all the pathophysiology and the reason why we do things, why we give this medication, why we don't give this medication, why we do this treatment, or why not, why don't we do this treatment. So all of these things I'm able to still tap into when I'm teaching, as a hospital educator. So again, like starting as a clinical, as a bedside nurse, for me it has helped me as a nurse, and I feel like it has given me a very good foundation to where I am now as a nurse educator. Education is another pathway that many of us can go. So when I was in the Philippines, the usual pathway really is like, you become a nurse, and then you either work in the clinical area, move up the ladder from a charge nurse, a manager, supervisor, or like a chief nurse or something like that, depending on how your healthcare systems are structured. Or you become a clinical instructor and then become, an assistant professor, associate professor, a full professor, something like that. And that was my thought before. Like I was like, maybe like this is the pathway. This should just be the pathway that I'm gonna go. But when I moved abroad, I realized that there's actually more pathways. So in terms of education, it's not just about teaching in academia. You can actually be an educator in a clinical area too. Or you can focus mostly on nursing professional development, which is a big thing here in the United States. So we have like an NPD specialist, including myself. Um, or maybe I can specialize in infection control. So this specialty-based nursing is a very big thing abroad. And I hope like wherever you are right now, I hope that in your countries, like these things are um, being talked about, or if not, are being implemented, right? Because it would then provide opportunities for the nurses in your country, including yourself, the opportunity to grow in nursing. I've had this conversation with some of my friends who are based in the US but are also actively giving back to our home country in the Philippines. And they have been having conversations with some of the um, organizations back home in terms of, for example, establishing an advanced practice nursing. Because here in the US, you can be a nurse practitioner. I believe in other Western countries too, which is really great because, with these challenges of access to healthcare, if there are a lot of healthcare providers there, including nurse practitioners, not just physicians, then you can ensure that those who are in the far-flung areas, those who doesn't have access to healthcare, will then have access to at least basic primary care, right? Leadership, very common career pathway for many nurses. As I said, like it's mostly like moving from bedside nurse to like charge nurse, unit manager, or something like that. And the same goes into the different pathways too, because like even in the education pathway, like you can be assistant professor to associate professor to full professor. You can be the dean. You can be a program director. So there's really that pathway even in the subspecialties that you're going to be going to. A lot of our nurses now are involved in research. How amazing is that, right? So many nurses are now generating new information that helps guide and that helps provide evidence to guide nursing practice so that we provide high quality care. A lot of nurses here in the US, a lot of nurses are involved in policy, which is really important because being involved with policy ensures that nurses are protected and that people, especially in the nursing side, are really looking at the welfare of nurses because sometimes, and I guess like most, if not all of us, are aware that there's this traditional belief that nurses are physician's assistants or something like that. But the reality is um, we are actually an autonomous profession, right? We are able to make decisions on our own. We are licensed professionals, and and we need to have those policy that protects us as professionals, and we need to have a policy that guides our practice as well. Um, and again, like there's a lot of things, and who knew that as a nurse you can also be a business person, you can be an entrepreneur. If you come to think about it, healthcare is actually a business. um, and that's the fact of the matter. Like here in the US, um, most if not all are, like there needs to be an insurance, and if not, it's healthcare services are being paid for by the government. So um, healthcare involves money, bottom line. So like as nurses, you can actually be an entrepreneur. And I'm not saying that you're going to be, in terms of being an entrepreneur, you can sell different services too. So for example, for me, since I have an experience in professional development and in education and workforce integration, I set up my company in terms of a coaching and consulting business. Many of you have, I would presume, have thought of like becoming business, or like have done some other business related stuff that can be related to nursing. So I know one nurse, one of my mentors before, who has gone into establishing a review center for nurses who wants to move to the US or other parts of the globe, right? And that's the big thing, because and like by setting up that business, you're helping others who are preparing to migrate. So there's really a lot of things that nurses can do in their careers. So in terms of my career path, as I've mentioned this already, so I'm just gonna brush through this. I started as a med surg nurse, worked as an ICU nurse for a few years, and then when I moved to the Middle East, I worked as a post-acute rehab nurse, and then also worked with long-term care patients who were ventilated, and then eventually I sort of moved into the education side of things. In the Middle East, we call the educators as clinical resource nurses. And then eventually I did some part-time gigs as an assistant professor in one of the nursing schools, worked in simulation as well. And then eventually at one point in my career, I became a director overseeing trainings for international nurses. Now I'm a nursing professional development specialist and nurse educator in a hospital. And recently this year, I started my business in coaching and consulting. So I never would have thought that I'm going to be bouncing back and forth, between bedside, non-bedside, clinical, non-clinical, bouncing between countries and stuff like that. So if you can see, from this career path, my path is not really like go up, 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 or just one straight line. It's sort of like one connection from another, and it's not always about like, oh, being a leader and being a member of a team or something like that. So it, in a way, like my path was connected by bridges, right, from one phase in my career path to the next phase of my career. And one of the things that I've seen with many of us, in terms of career shifts, because many of us are really just surviving the shifts. And by shift, I mean like the shifting of your career from one area to another. Many of the challenges that we face is that many nurses navigate their careers by chance. And again, this is where the necessity of making sure that you know what you want to do, where you want to go, is very important. Because we just go to work, not think of what will happen tomorrow, and then just face things as they come. We never strategize on what are we going to do next, or is this really something that I'd like to do, or I'm just content with what I have, as long as I get the salary. And again, I'm not saying that is wrong, but if you think about it, let's say for example, as a bedside nurse, we're not getting young, right? Like honestly, for me, I don't think that I can still work with 10 heavy patients right now. Like some of my back just hurts sometimes, right? And maybe for those who are young, we have a lot of interns here. We have a lot of like new and fresh early career nurses. I know that you have all the energy and you have all the strength to be lifting those patients, to be doing all the things at the bedside, to be running around. But for us who are getting older, although like I refuse to get to be called old, there are just things that you can do. And that's the thing too. One thing that I've realized as well, as I was transitioning from one role to another, is that it's because some people will say like, oh, you're just becoming lazy because like you're getting old or something like that. It's actually really not. Um, as an educator, I feel like I'm still making. Oh no, I know, and it's not. I know that I'm still making an impact because the wisdom that I have gathered all throughout those years, I'm now able to transfer to the next generation of nurses, right? So I'm able to help ensure that what I know is shared, and that whatever is shared will be utilized to provide quality care for the patients that the nurses that I train are going to be providing to my patients. So again, it is very important for us to design our careers and not just drift through it. And I know that this is easier said than done because, as I said, when you are again, a lot of us here are like new nurses, right, or are still in nursing school. There's no subject or there's no course that tells you how do you design your career, right? Because most of the schools, and I've been an assistant professor in a school, most of us will just try our best to make sure that these nurses pass the course so that they can graduate nursing. And of course, like that should be the goal for schools, right? To help you complete your degree and make sure that you are a safe practitioner where when you are in the clinical area or when you are in the profession. But it shouldn't stop there. There needs to be sort of like a long-term plan as to where do you go, what do you want to do. Because if you don't have a clear direction, if you don't have a clear sense of like what you want to do in your career, sometimes your career will just feel reactive. You will just go there and like, okay, it is what it is, as many people would say, right? And sometimes then you don't work hard on things because you don't really have a goal. You don't know what what you have to work on if you do not know what direction you want to go. Okay, so there's another Mentimeter survey. I'm curious to know, what is your biggest career challenge that you are facing right now? Again, when I was about to study nursing, one of the main challenges that I had was really the financial side of things. As I said, I came from a poor family, didn't really have a lot of financial support or like financial resources. And so what I did, I was blessed because I graduated on top of our class during my high school years. And so like there was part subsidy from the school that I enrolled in, because they provide scholarships. And one of the biggest challenges was really like, not having the money to buy the equipments as a student, or to pay for tuition. So those are some of the career challenges that I've experienced initially, or even before I became a nurse. And that problem, the financial struggle, still resurfaced when I was a nurse, because, as I said, like in the Philippines, and I hope it has changed now, the salary is still not as much as what we would have wanted. I know that there's a pay difference in terms of whether you work in the government or you work in a private facility, but there are those nuances, makes it a bit challenging as a nurse back home. Yeah, no finance for transition. So even transitioning, like even my transition from the Philippines to the UAE to the US, it was not free. Like I have to look for money to pay for my exam, for my NCLEX exam, for my DOH exam to go to the UAE, for my NCLEX exam to go to the US. I have to pay for my English exams, and they are not cheap. right? So these are some, and even when you are a nurse already, and if some of the hospitals will not provide you the training, and if you want to go for basic life support or advanced cardiac life support or pediatric advanced life support, these trainings are not free, and these trainings are not cheap. So that can definitely be one of the challenges that you're going to be facing. Lack of clarity, for sure. And again, like sometimes when you do not know what you want to do, or when you don't have the right mentor that will help guide you on the next steps, it can be so daunting, right? Like, what am I going to do next? And this is where it is also important for us to really expose ourselves out there. When you start your nursing career, I would strongly suggest, and this is just me, it would be good for you to talk to nurses, who have been in the profession for quite some time, to really ask their experience. How was it when they were transitioning? Did they know that they just want to become like an ICU nurse and like, stay there for a long time, or have they moved around? Because for me personally, I have moved around. And with all those movement, with all those transitions in my career, what I found out was that I love teaching. I love educating. So that was sort of like the common denominator of all my experience. Like wherever I was placed, I really enjoyed precepting somebody. I really enjoyed mentoring our new nurses in the unit or something like that. So in a way, that provided me with clarity, even if I didn't have a mentor, but because I exposed myself to various experiences, then it gave me an opportunity to really ascertain what type of nursing I wanted to. Bedside burnout. I'm telling you, I can totally relate. When during the COVID pandemic, even though I was already a nurse educator, there were days that I had to work at the bedside, and it was exhausting. It's really tiring. Um, I do not know what your shifting is like in the country that you are working right now. While I was in the Philippines, it's usually 8 hours. When I moved to the Middle East, it's like 12 hours, and sometimes you work 16 hours. Here in the US, 16 hours mostly. It's tough. It's tough to be on your to be walking for 12 hours. It's tough to not have a break. And that's why sometimes like you get burned out. It's tough to be working back to back nights. I don't know. I so admire people who can work straight four or five straight night shifts. I'd be dead. I can't work night shifts all the time. Um, and yeah, sometimes, and again, this has happened. Sometimes you go into nursing and find out that you don't enjoy nursing. That's just a fact. Um, when I was in nursing school, many of my nursing classmates, they didn't want to become nurses, actually. Some of them were just, it was the hype at the time that like, oh, you take up nursing, it's so nice because you're gonna be wearing white uniforms. It looks so neat and stuff like that. And so like many of my classmates before were just like, okay, I'm gonna take up nursing. They graduated, but actually many of them are not working in the nursing profession now. Some of them ended up becoming, like cabin crews and airlines and stuff like that. Um, really other stuff outside of nursing and outside of healthcare. So all of these things that you have shared here, these are common challenges, not just for you, but actually for many nurses as well across the globe. So thank you so much for sharing your insights. So how do we address those problems? How do we help ourselves? How do we find means to move from a problem to solving that problem? So through my own experiences, having navigated multiple transitions from one country to another, from one role to another, I eventually developed a framework called the bridge. Because as I said, when you transition, it's not necessarily like a ladder that you do the first step, second step, and it's like go up. Sometimes it can just be from one point to another, and then from this point to another. So it's like there are bridges that you cross from one point of your career, from one point of your life to the next point of your life. And it doesn't mean that it's always going up. It could be going down sometimes too, or it could be in the same level. But then that transition or that movement is needed at the time, right? So I would love for us to cross the bridge together. So talking about bridge, actually, bridge is an acronym for six aspects or 6 points. One is building awareness, which we're gonna talk about all of these steps. B is for building awareness. R is for readiness. I is for integration. D is for development. G is for growth, and E is for empowerment. And my hope is that I'll be able to give you some insights and practical solutions in terms of how do we cross the bridge by utilizing the bridge, and we can always walk and cross the bridge together. You will always have somebody that you can cross the bridge with, or you can be that person, especially for those who are in their mid to late career in nursing. You can be that bridge for those who are new to the profession. Okay, so let's talk about building awareness. um, the first step, really, when you want to cross the bridge, and I know that I reiterated this earlier, is knowing what you want, being aware of what matters to you. What do you value as a nurse? What energizes you? So, this should be the first question that you have to ponder, that you have to reflect on, as whether you're a new nurse, um, or whether you're a mid or late career nurse. You should have that pause and ask yourself, is what I'm doing right now giving me joy or giving me fulfillment? Right? Um, One thing that I've realized, and I know that I've shared earlier, that one of my motivations when I took up nursing was really to, was really the financial aspect of it, like finding a profession or a job that can pay well, so that I can help support my financial needs and I can help support my family back home. In fact, the matter is, I'm still helping my parents out. It's a cultural thing. I know it varies from different culture, but culturally in the Philippines, like my parents are not asking for me to send them money and stuff like that. I just feel like they've worked so hard to send me to school and to take care of me when I was a kid. So like, I would like to pay back or give it. I would like to return the favor of them taking care. So like, now it's my time to take care of them. Um, but like, as a nurse, again, ask yourself what energizes you. Is it patient care? Is it working at the bedside with patients, with their families? Is it teaching? Either teaching the patient or teaching new nurses or teaching your team or something like that, sharing your knowledge as an experienced nurse. Is it leadership? Do you enjoy leading initiatives, working with a team, making sure that there are improvements or something like that? Is it innovation? Is it creating some strategies or processes that will help improve things in your unit or in your hospital? So always try to ask, is what I'm doing right now fulfilling? Does it fill my cup? Because if it doesn't fill your cup, chances are you will feel burnt out. I know, like one person mentioned earlier, one of the challenges is like feeling burnt out. If you're not happy with what you're doing right now as a nurse, then you will definitely feel burnt out. You would not want to get up and go to work. It's like when you wake up, it's like, oh, I have to work again. And I've had that. I've at one point I've reached that point in my nursing life that I was just like, it's another 12 hours again, and I hated it. It was not fun. So that's the reason why, like, I really tried reflecting on, like, what do I enjoy doing as a nurse. And eventually I found my niche, which is nursing education and nursing professional development. um, it's also important to make sure that, again, like, with whatever you do right now, that is aligned to your value. So what do you value most? Because if it's not aligned, chances are, again, there will be an internal conflict of like, why am I doing this when in fact, like, I really don't want to do this, right? So bottom line, for you to start crossing your bridge, it's very important to build awareness. Again, ask yourself, what do you value? What energizes you? So, next is a Mentimeter question. So, I'm going to throw this question to all of you. So, to all of you who are here today, I want you to tell me what motivates you most in nursing. And there's no right or wrong answer. As I said, like when I was a new nurse, what motivated me as a nurse was really from the financial side of things. Like, I mean, like, the fact of the matter is, we study a certain profession because we want to have a job and we want to get employment, and we will have a salary, right? So if that is what motivates you, that's okay. Some of us are motivated by providing patient care. That's very noble. That's amazing. um, I know that, as I said, like, my perspective about nursing has really shifted when I started working with patients in the hospitals, because it has given me the opportunity to see the challenges and how I can help in my own little ways. Like, I don't have to have a lot of money, but if I provide care to this patient, um, being empathetic to this patient, I know that I'm making a difference. And I guess, like, for me personally, when I'm working at the bedside, when I see a patient feel better, or like if I see a patient improve in terms of their medical condition, or if a family member says thank you, that makes me so happy. That's something that money could not buy. Um, Research, that's amazing. If that motivates you, that's really amazing, because, like, honestly, like, I have done research too, but like, um research is tough, right? So if you're motivated to do research, that's amazing, because then you help generate new information to improve our practice. I know that somebody said nothing motivates you in nursing. Go back to B. You have to reflect. You have to have an awareness. Why are you not motivated to become a nurse? Because if you're doing nursing now, and you don't necessarily know why you're doing it, or you're not motivated to do it, you're just wasting your time, and you're wasting your money too. I would presume that nursing school is not cheap in, wherever you are. Here in the US, it's so expensive. In the Philippines, nursing school is also expensive, from a Philippine perspective. So if you feel like nothing is motivating you to become a nurse or to work in nursing, I would strongly recommend that after this talk, try to reflect as to what do you enjoy doing. If there are other things that you enjoy doing, then maybe try to find ways that you can start in that pathway, so that you will not be wasting your time, because we can never regain our time. Time lost is time gone. Like, you cannot go back in time and, like, oh, I should have done this, instead of, like, wasting my 4 years in nursing, or wasting my finances to study nursing, and then, like, now I'm not a nurse. But then again, we have different circumstances, but that's just an advice, from a person who doesn't have a lot, and, like, because I wanted to make sure that whatever your resources you have, you put it in the right bucket. Teaching, that's really amazing. Like, if teaching in nursing motivates you, um, for me personally, I find it very fulfilling to be able to help the new generation of nurses, teaching new nurses to become better nurses. And when they come back to you and tell you that, oh, thank you so much for sharing your experience, your knowledge with us, because we're able to do this and that. For me, like, that's very fulfilling. And changing a client's life, I think, like, as nurses, we do have an impact. Sometimes we might not see it, but at one point in your nursing life, whatever setting you are working, whether at the bedside, non-bedside, in the academe, in corporate, you will encounter something in your life that will let you know that you actually created an impact. For example, when I was working in my most recent job, I was working in the corporate side of things, and I was helping international nurses. I was helping prepare international nurses come to the U.S. And when I can see those nurses succeed here in the States, that gave me that sense of fulfillment, that I was able to pay it forward to my fellow international nurses who wants to find a better life abroad. So, like, all the things that motivates you right now, hold on to that. Make that as your why, because I'm telling you, nursing, and healthcare is really not easy. You will experience a lot. It's not a perfect field. It's not a perfect profession. But if you know your why, if these challenges will come up, you will realize that, oh, this is the reason why I took up nursing. Okay. Readiness. So we have B, and then we have readiness. I want to emphasize the importance and the significance of investing in yourself. Because if you invest in yourself and you become ready for the world as a nurse, it expands your option. So when I started my nursing career, one of the things, I started as working as an ICU nurse. I saw a few nurses who started doing their postgraduate, like their masters, and I was like, "Will I do that? Like, I don't have money. My salary was not very good. Um, I didn't have time because like I was working 5 to 6 days a week so that I can get paid overtime and have enough money because I was living in the city when I was working, and city life is so expensive. And that really gave me perspective in terms of like, do I do this and that, or like, should I invest in this and that? And I'm glad that I did, because all of the things that I've done has actually led me to where I am right now. So, after nursing, I went into masters, and then I at one point I even borrowed money from my parents because I said like, I really want to do this, and like I could not afford it. My salary is just enough to pay for my apartment, or like for the room that I was renting, and for food while living in the city. Um, and I'm just so blessed, like despite my parents not having a lot, like they were so supportive in terms of like investing in myself. Like they really value education. So, they gave me the financial support. At one point, like I had to take a loan to pay for school and stuff like that. Um, and also like learn how to ask for scholarships, how to find means. So I took some certifications and stuff like that, and because of the certifications, it has helped propel my career here in the US, and I'm sure it's going to happen for you too wherever you are right now. So I'm telling you, like, it's never a waste of time to go for a postgraduate degree, to go for a certification, to study about something, because that is an investment that nobody can take away from you. Once you have the education, and I know, like, sometimes people may say that, oh, are you just like taking this for the sake of having additional letters after your name or something like that? It's really not, because if you're authentic in terms of your in terms of investing to yourself. For me, like the reason why I study, let's say first my PhD in education, was really because I'm so passionate about education. I really want to become a better educator. And the thing with education is that you can be the most competent nurse in the clinical area, but if you don't have a background on, for example, adult learning theory, how do adults learn, or something like that, or what's the process or framework in delivering an effective teaching, then you will never be able to transfer that knowledge to the next generation, right? Because maybe like I'm so fast in teaching stuff, but like, I didn't try to understand that my learners have different learning styles. So this type of stuff. So bottom line is that whatever you do right now, if you feel like you're investing so much in terms of education, you're spending so much money on schooling and getting certifications and getting some trainings, don't look at it from that perspective. Look at it as an investment that nobody can take away from you. And maybe the return of your investment might not necessarily be right now, but I'm telling you, you will get that in the future. There will be a return of investment, especially when it comes to education and when it comes to helping you become ready for the next version of you. So that is readiness. Integration. Integration is very important when you're transitioning, because as you are moving into different paths or landscape, like you will integrate yourself into teams. You will integrate yourself into different systems and different cultures. As I said, like when I started as a nurse, I started in a med surg unit and then moved into ICU. And I'm telling you, the culture in a med surg unit is so different with the culture in an intensive care unit. Um, there, it's difficult to explain because maybe it might be different. I don't want to badmouth like my seniors and stuff like that, but um, in the older generation of critical care units, like there's this concept of like seniors eating their young. Um, Working in an intensive care unit is so scary. Before, like it's like I'm walking on eggshells, like I'm tiptoeing every time, because my seniors they would like eat you if you don't know this and that. In a way, it has helped me, because like now that I'm a nurse educator, like all those things that I've learned while I was training as an ICU nurse is still in here. It's still stuck in my brain, and I'm able to pull those information out when I need to teach, for example. Um, but the bottom line is like there will be different team dynamics, and it was the same when I moved from the Philippines to the Middle East. Very different team dynamics, which was mostly impacted by the culture. So let's say, for example, when you work in an Islamic country, as a male nurse, I was actually not allowed to work with a female patient because that is the culture. That's against their religion. When I moved from the Philippines to the Middle East to the US, there was a very different concept in terms of speaking up. In the Philippines and in the Middle East, when you speak up, that is frowned upon. Like you do not talk to your seniors. You do not question the hierarchy because seniority matters. But in the United States, you can speak up. You're encouraged to like speak up if you're not happy or something, or if something is bothering you, talk and let's discuss. And it took me quite some time, to like find my footing in terms of like, oh my God, when do I speak up or when do I ask questions? Because I was working most of my life in the Philippines and in the Middle East, where if you speak up, there might be retaliation. They might hate you for asking questions, or they might not be happy, and you might be in trouble because you've raised a question, you said this and that can be taken against you. And I'm not saying that the people that I've worked with in the Philippines and the Middle East are bad people. They're not. It's just that was the culture. And that's okay, So eventually, like I've learned how to navigate those cultures. So even with that, when you're moving from one place to another or from one unit to another, you have to actually really make sure that you understand how can you integrate better. There's no such thing as a one fits all strategy when it comes to integration. It's really about getting to know the people that you work with. And it's not about even being hypocrite too. You cannot be like, I'm just going to pretend. It's not about pretending. But if you know and understand the actual culture, then you will find that there's a better way, or there's a system which you can utilize so that you can work better. One of the things that I'm always, in my previous job, when I was working with different hospital systems as they bring in international nurses, sometimes the focus of hospitals here in the West is like, we bring international nurses, train them in terms of what to do when they're in our hospital. But when I worked with them, I also taught them that it's not just about training those international nurses coming in. It's also training your team who will be working with these nurses so that they know how can they facilitate the integration of these nurses. Because, for example, and I'm speaking from experience as a Filipino nurse, most of the Filipinos will not speak up. Will just say yes all the time. The challenge with that is that what if there is an erroneous, or there is a wrong medication order, for example, or like if there is an error in the order, and you just say yes all the time, even if you know that, oh, this is wrong, but because I'm scared to speak up, or like raise a question or something like that, that then puts your patient at risk, right? So I have to learn, like, for example, like, oh, okay, so here, if this is the physician, I have to raise my concern in this way, versus the other physician who is more outspoken. I can be just like, hi, Dr. So-and-so, I've noticed this and that. Should we do this or should we do that? It also helped, to be honest, that I was working in the critical in ICU while I was in the Philippines, because in the ICU, it was mostly 1:1. And so like, I know my patient from head to toe. So when I talk to physicians, I usually like tell them, like, if I have a concern, I tell them that, hi, doctor, something, this is the case of my patient, I'm having a problem. This, should we do this, 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 this? And the reason why I can do that is because I know my patient. But then again, that then boils to the culture of the specific unit, right? And it helped me in a way that I was exposed to that, because then I was able to navigate the teams, the nuances of the teams, the systems, and cultures. One of the funniest things as well in terms of integration is that there's going to be a lot of nuances culturally. So one of the funny stories that I always share when I have this type of talk, especially on the topic of integration, is the language barriers, right, that we experience. And by language barriers, sometimes you might think that, oh, like you speak good English, like you can talk in English, you should be fine. But actually, that's not the reality. And I encountered that on my first few weeks here in Boston. So I was working as a brand new nurse in the US. And then one of my patients asked me, Arnold, can you bring me a Johnny? Um, I didn't know what a Johnny was. And I thought, like, my patient was referring to my teammate, John. This is not us, but like, I'm just putting this as a picture. And so I called my workmate, John, and asked him, like, oh, John, I think my patient is looking for you. Can you come to my patient? And so he said, like, why? Like, you're there. Like, what does your patient need? I brought John to the bedside only to find out that the patient was looking for a patient's gown. So seemingly in this part of the world, they call a patient's gown, or like, like the pajamas that looks like a patient's gown, a Johnny. And that was like a learning moment for me, right? That I realized that I have moved into different parts of the globe. I have worked in different hospitals. I work with patients' gowns, but then there are different terms that the locals in a specific state or city or country use to refer to this type of things. So one of the main important things when you are trying to integrate is to really also, I think it also helps to conduct a research in a way, try to, you have access to a lot of information nowadays. The internet is always there. So make sure that you find time whenever, you're transitioning from one role to another or from one country to another, to find time to actually have the due diligence to explore what to expect. What are some of the cultural nuances and even some of the terms that they might be using when you're going to be moving there, so that you can easily integrate, and at the same time you also avoid errors, right, when you are providing care. Okay, so we've done with building awareness, we're done with readiness, we've talked about integration. So now let's talk about development, and it's really developing yourself and also others, right? And development can be about you learning, you getting something from a mentor or a coach, you building your skills, and you becoming a leader. Because when you're a leader, you will learn a lot of things from your members and even from the high ups too. When we talk about development, it's always important to make sure that you do not just limit yourself in terms of like, for me to develop, I want to enroll in a course or something. It's not that way. Development should be holistic. Like, you need to understand what are your strengths and what are your weaknesses. What are the things that you need to improve on? And this, I think, like in this aspect, one of the challenges is sometimes we as human beings, and I guess maybe from a cultural perspective, myself as a Filipino, sometimes I have a hard time taking in criticisms or feedback. And it's not that I'm not open to them, but like, it's just like in the Philippines, we're not so used to giving feedback. And if they give you a feedback, it would seem like, I'm so stupid, or I didn't know, that's why they're giving me this feedback, right? So that is one of the things that I have to unlearn and relearn. I have to unlearn that feedback and constructive criticisms are given by people who really cares for you, because they want you to become better, they want to improve. And so when I started moving, when I moved here, or when I moved abroad, I've learned to seek out feedback or comments or recommendations, and I don't have to wait for them, because I know that I am not perfect. Nobody is perfect, and there will always be opportunities for us to improve and to grow. And if you do not seek those information out from the people who really value you, from your teammates, from your colleagues, from your leaders, mentors, you can never grow, because you will always think that, you know what, like, I'm so good at this. I'm better than anybody. So I shouldn't be asking for help. And if you do that to yourself, chances are you will never develop, because we can only develop, we can only improve, we can only um, change things if we are aware that there are areas that we can improve on. And chances are we will always have areas for improvement. Growth. Growth, growing in your profession, growing in your career, actually is not just for yourself, because your growth as a nurse, as a professional, actually expands your impact. As I'm saying, like, now that I'm a nurse educator, I am not just impacting one patient. I am impacting more patient. And then you might ask, like, how are you impacting patients when you're not even at the bedside? But I am teaching nurses and helping them become better nurses, or help improve or enhance their competencies, so that they can provide better care and high quality care for their patients, right? So as you grow in your career, as you grow as a leader, or as an educator, as a professor, wherever you are in your career in the future, that means that your range of impact actually expands. And that's the reason why it is important for us to find ways for you to grow. Don't limit yourself with what you have right now. Always know that there's other things. There's a lot of things. There's a lot of things beyond the horizon, beyond what you can see. And that's why it's very important for us to, really start exploring things, building those networks, like talking to people, finding those mentors. Um, one of the things that has really helped me grow is really finding those people that I know I can ask questions, and who can tell me, like, an honest answer in terms of, like, what are the things that I can improve on. But then again, if I step back, like, it's also very important to not take things personally when people are giving you feedback or pointers on what are the things that you can improve. Sometimes it's not easy, if I have to be honest, because if you're not culturally used to receiving feedback, it's not easy to be criticized, right? Sometimes it's like, ugh, I don't want you to be telling me what my flaws are. Um, but if you do not ask, then you will never know, and you can never grow, right? So again, the reason why we aim to grow, the reason why we aim to develop, is we want to expand our impact. Um, and then empowerment. Empowerment is one of the most important aspects in, as we help, as we transition, because the fact that we are experiencing some struggles means that other people, other nurses, are also going through the same struggles. It doesn't necessarily mean that all of us go through the same, like, you know go through the same challenges point by point. But what I'm trying to say is, like, if you experience that, chances are there's another nurse who's experiencing that in that field, right? So it's very important for us that when we are building our bridge, you also help others cross their bridges, right? So if you know that, let's say, for example, my experience is that, like, if people know that this is my field of expertise, or these are the certifications that I have, many people have reached out that, oh, like, I wanted to pursue, let's say, for example, a board certification for nursing professional development. Are there resources that you can share, or can you connect me with somebody who has, like, a vast experience in this, and who can give me pointers to help me prepare for the exams? So these are some of the things. Like, empowerment does not necessarily mean that you will be talking to this person, like, every hour of the day, or you're going to be giving this person all the resources. But if you don't have those resources, like, for example, if you don't have that knowledge on how to do it, chances are you might have a network who knows how to do it. So even connecting, helping the people connect with somebody who might be a good resource for them, who might be a good mentor for them, helping them, who can help them cross their bridge, that's already empowering your fellow nurse. So again, always think that there's always something that we can do, no matter how small it is. And this is a challenge too. Sometimes we think that, oh, I'm just a new nurse, like I don't think I can help out, or like I don't have a lot of resources, like I don't think I can help. I always believe that no matter how simple it is, no matter how small you think your help is, that is still help, and that can still help empower your fellow nurses. So, in summary, and I'm just trying to check my time because I might have been over time. Bridge. When we talk about bridge, again, it's building awareness, readiness, integration, development, growth, and empowerment. And please always remember that your career is not a straight road. It is a series of bridges, and because it's a series of bridges, it might not be like one step, two step, three step, and always going up. It might be from one point to another, from here to there. It might be up and down, and that's okay. That's normal. People transition from one point to another. What's important is you help yourself and or you help others cross their bridge. And if you're happy in your career right now, that's well and good. But still, you never know. Like at one point in my career, I thought I was already, content, and I was already okay with what I was doing. But then there were things changed. My circumstances changed, and I realized that, oh, okay, you know what? Like, I actually value this more than this. And by knowing what I value more, I realized that, okay, I might need to have a shift. I might need to change, and I might need to cross another bridge. And so I did. So generally, I think all of these things I've mentioned already, in terms of what we can do. So again, make sure that you're aware in terms of what direction you want to go. And if I'm not saying that this is like a one sit down activity, right? Like it's not like, okay, I'm going to sit down for an hour now and reflect on what are my goals, what I value most. It's not like that. It might take time, and that's okay, as long as you put in the effort in trying to find your direction, find a path that you want to move into. Learn, invest in yourself, try to integrate and adapt. Try to put yourself out there and see up until what else can you, or up until where can you squeeze yourself. Because if you will never try, if you do not try out of fear of failure, you will never know. Like for me personally, I've failed a lot in my life, personally and professionally, and that was okay. The moment of failure, it's never fun, but eventually you'll realize that, oh, okay, that failure, that rejection was a redirection. That failure was actually a lesson for me not to do it again and maybe find other stuff, right? Build your network. Network is so important. The reason why I have, for example, the jobs that I had in the past and the current jobs that I have was because of my networks. Like they've opened doors for me. They help build the bridges, for me to go from one place to another. So connections are very important. And it has to be authentic connections, right? It's not just for the sake of like, oh, this person works here and can give me a job or something like that. It's always good to have authentic connections, because you never know what opportunities will open up based on the connections that you have. And if you do this, you will have local and global opportunities. Like, I'm not saying that all of us wants to move abroad. I'm sure that not everyone wants to leave their home countries and their families. I've had a lot of friends who are still working in the Philippines and are happy there, and that's okay. For me, like I just enjoy traveling and like experience and expanding my horizon, and I'm also happy where I am right now, even if my family is away from me. So bottom line is that if you try to cross the bridge, chances are you will have opportunities, whether locally or globally. I want to be respectful of everyone's time, but what I'm going to say is that I want you, after this talk, I want you to reflect on if you could make one bold career move without worrying about the finances, without worrying about any other thing. What would that be? If there was no restrictions, what bold career move would you do or would you make? Okay, so I'm not gonna let you answer anything or something like that, but I just want you to reflect on it. In terms of global impact, always believe that if you do something that you're passionate about, chances are it will create rippling effect, and as I said, it will create an impact not just locally and globally. I feel so blessed, that through my passion of education and training, I was able to help a lot of international nurses transition to the US. And because of that, I was nominated. I became one of the top 10 finalists of the Aster Guardians Global Nursing Award in 2025, um, among 100,000 nurses who applied for the award. So the 10 of us had our own initiatives in our own home countries. Like we represented, I represented the United States. We have friends from Switzerland, Papua New Guinea, United Arab Emirates, Hong Kong, Kenya, India, Malaysia, Ghana. So all these nurses, like despite our differences, despite the different struggles that we had in our home countries, we did something, and we thought, like it was so fun talking to these amazing nurses, because some of them were not really aiming to like get not some, all of us were like not necessarily trying to do the things that we do because we want to be recognized for it, but eventually, because we created an impact, it created a rippling effect that made what we did visible, not just locally but globally. So my last question for you is that, what bridge will you build next? And I hope that bridge is, the bridge of going to the next version of yourself, from where you are right now to where you want to be. And I'm telling you, it's not going to be easy. There needs to be a lot of effort. There needs to be a lot of investment, whatever that is, whether time, whether effort to reach out to people, whether finances. Of course, you have to weigh the pros and cons when you invest into something, but make sure that you do something to at least try, to at least give it a try, so that you can move from your current version to the next version that you envision yourself to be. And I'd like to leave this note with you. Becoming is not a straight line. It's not a straight one up line. If you want to become something, if you want to become somebody, it's definitely a series of crossings. You cross from here to there, from there to everywhere. And some of those crossings you chose, but some are necessary. So don't ever be afraid to give it a try. Don't ever be afraid if you think like whatever you're doing right now is not a straight line. There's a lot of rejections, because again, rejections are redirections. And I'd like to promote my book as well. So, you can get this on Amazon. You can scan this QR code, or you can search Building the Bridge. This is a more in-depth discussion on the things that I've shared, and some reflections as I was transitioning from one career to another, from one country to another. And I'd like to thank everyone for staying with me. I'd like, if you want to connect, you can find me on LinkedIn. Just search Jose Arnold Tariga. Or you can visit my website for Bridge and Beyond, and maybe we can talk about, one-on-one coaching for you if you need some coaching. Or send me an email, founder@bridgeandbeyond.com. If there are things that maybe, if not me, then maybe I can connect you with somebody that can help you out as you transition in your career. So thank you so much.
Wow. Wow. Can we put hands together in the chat box? Let's appreciate Dr. Arnold for this wonderful session. Wow, wow, wow. So many things to learn. So many things to learn. I'm on the YouTube channel, and I'm seeing a lot of great comments, a lot of great feedback coming from our participants on the channel. If you cross the bridge, there lies multiple opportunities waiting for you, right? We can build big things from small places. Okay, we're having some of those comments from our participants coming live on the screen. Right. So if you have questions, we are moving now to the question and answer section. So you can please go ahead and drop your questions in the chat box, and we will start taking them. Dr. Arnold is a really gifted teacher. I'm getting that feedback from the audience. How you have systematically, raised all the points and presented them. It's really awesome. So while we wait for questions, I have some here to start with.
Of course.
Okay, so I noticed from your presentation that you have moved around a lot. And I can perfectly relate with that. I started my career from Nigeria. I went to Hong Kong for my PhD. And then I am currently in Canada. I did my postdoc at the University of Alberta, and then moved from Alberta to Nova Scotia, where I am currently as an assistant professor at the School of Nursing, Dalhousie University. So I can perfectly relate with your journey moving from one place to the other. My first question is, how will you know it is time to move?
That's a, don't worry, Dami, that's a very tough question to answer. But
Okay.
from my personal experience, I knew that it was time to move when I started seeing things not working my way. You know,
Hmm.
like when there was a time during these transitions when I felt like, oh, like I started becoming more stressed. I was not getting enough sleep or something like that. When I started seeing things that was not working for me and was stressing me more, it was not motivating me. It was making me feel more burnt out, and it made me not enjoy what I was doing. For
Hmm.
me, that was the sign that I need to move on, or that I need to explore some other things. And again, like during those transitions, like I had different reasons. There was not one size fits all reason for like moving from one area to another. Like
Okay.
moving from the Philippines to the Middle East, like my reason was the financial side of things. Like I
Okay.
knew that I needed more money, so like I moved out. And then moving from the Middle East to the US, it was like I could not see other opportunities to grow and subspecialize more as an educator. And
Hmm.
that's the reason why I moved to the US, because I know here in the US you can certify. I would presume it's the same in Canada too. Like you
Yeah.
can really specialize and be board certified and something like that. So um I think it all boils down to like try to see whatever you value or whatever is making you happy at the moment. And if it's not making you happy anymore, and if you're not valuing that anymore, if you feel that it's not giving you value, and or if you're not adding value to what your initial goal was, then chances are you might need to find other ways where you can add value and you can get value as well.
Awesome, brilliant, brilliant one. I know our participants have taken note of that. You might be interested in these comments from the chat box. Indeed, this session has really lifted my spirits. That's fabulous.
Thank you
So,
so much.
yeah, yeah, it's really inspiring hearing your story. And another participant from Canada said, "Your story is so inspiring. I will order your book right away."
Oh God, thank
Yes,
you. Thank you so much.
if we can get this much value from your presentation, I can only imagine how powerful and how inspiring your book is going to be. Thank you so much for writing it. I love reading too, and I'm also ordering your book right away, and
I mean,
we are going to be using it in our boot camp too. Okay, so the next question I have for you while I wait for questions from our participants is, as a researcher, something caught my attention really during your presentation when we were receiving comments from our participants, and
sure.
that's the issue when someone mentioned that they don't like nursing, or
Hmm.
there is no aspect of nursing that interests them. So, what will be your advice? Because I was also in that situation at a point in my career. I hated nursing. So
Hmm.
there's a difference between not liking nursing and hating nursing because of what I was seeing around me as an
Right.
undergraduate. I really hated the profession. So something changed in my journey as I migrated, as I moved from undergraduate to postgraduate. So what advice will you give for people who currently nothing interests them in nursing and they don't like this profession? Thank you.
I think my take on that is that it's very important to maybe expose yourself to the different sides of nursing. Um,
Mm.
to your point, like for me personally, when I was still in the Philippines, I initially hated nursing because I hate needles and stuff. Uh,
Okay.
but what I was not happy about nursing is the lack of resources, for example.
Mhm.
And when I started moving around in different healthcare systems, even locally, there were hospitals that are better, more resourced compared to others.
Yeah.
And then I learned that in hospitals with good resource, or where resources are enough, then I'm able to provide the quality care that I wanted to have.
Yeah.
But that also helped me realize that there should be something that I'm able to do. And for example, one of the things that I did was, because I was able to establish a good network, then
Mm.
I was able to connect my network to those hospitals who didn't have a lot, and
mm,
maybe have medical missions, or maybe ask for resources that they have in excess in their facility that they can share to, those areas where they don't have enough. So
yes.
moving yourself from one environment that you are not happy with and trying another environment might be a good way to really test if nursing is really for you or not. If
Mm,
you're not happy, for example, in one unit, um, as I said earlier, like I'm not very interested in emergency department. It's just too chaotic for me. And bless all the emergency nurses; they're amazing in what they do, but I just can't survive in that environment. And so I moved myself to the ICU, and it made me so happy. And that then became the foundation of my nursing career. I know I moved into other areas and specialties in nursing, but again, just understanding what you like and what you dislike about that aspect of nursing, and maybe giving it a try. Try some other stuff first. And if it doesn't really work for you, then it doesn't. That's the thing. I think, like I mentioned earlier, that if you do not find value in what you do as a nurse, or if you don't really find it appealing, it's always good to maybe really explore other professions or other options, because you
mm.
do not want to waste your time and finances too, because it can be expensive studying.
Yeah. Wow, beautiful response there. I'm seeing a lot of beautiful comments in the chat box. People really enjoyed your session. Someone said, "Thank you so much, Dr. Josie. Your story has really inspired me as a nurse." Someone also said, "Dr. Josie, you sincerely made me love the nursing profession the more." This is
Wow,
really, really
so
beautiful.
heartwarming.
Okay, so my next question is around your the way you have built your career. You have built a global nursing career. So, what are some of the things that prepared you for the global stage in nursing? So, what are some of those things that, because I know many of our participants have interacted with many, and
Mhm.
they will also be interested in building a global nursing career, just as you have done. So, what are those things that can prepare our participants for that?
In terms of building, your global pathway, if you want to be like a global nurse, one thing is to make sure that you are up to date with whatever is happening globally, not just locally. And chances are, whatever is happening globally is actually impacting the local healthcare environment. That's usually the case.
Yeah.
Um, so always make sure that you do your research. I mean, like, the great thing about now is we have access to technology and to internet. So you really have a vast resource in terms of like knowing what is the latest, what does the evidence say should we do as nurses, for example. Another thing is to increase your network. I have to be, and I always say this when I have some talks about branding and networking. The reason I was able to get some of the jobs that I have in the past, and like even the current ones, was because I built a very big following in LinkedIn, and those network have actually opened doors for me. Um, Dr. Dami, like even the most recent job that I have right now as this hospital educator, it came
Yeah.
from LinkedIn connection. So
Wow.
yeah, and like the previous job that I had as the director of another organization, it was from a LinkedIn connection too.
Wow.
So it's really having that network, because and another thing too is also just being curious on what is being practiced in other countries and trying to imbibe them. If there's an opportunity for you to utilize those practices, adapt those with maybe some tweaks in
Hmm.
your home country, that will definitely help you build your persona as a professional if you want to move abroad, because there's a lot of nuances in terms of local practice setting and international practice setting. And I'm sure, Dr. Dami, you can attest to this, having moved around.
Definitely.
And having that, I think having that desire to learn and even practice those things before even moving to the next country will
Hmm.
help you adapt easily. It will help you integrate better.
Hmm. Well, well done. That's a really beautiful response there. Thank you so much for sharing. And while we are speaking, some of the things that really jumped at me are things like branding and networking. You spoke about LinkedIn connection. I also have gotten jobs through LinkedIn,
Mhm.
and in this boot camp, we have a section actually that will be targeting how people can optimize their LinkedIn profiles. And I would like our participants to connect to that section. So if you are here and you have not registered for the Nursiscope Career Bootcamp, please try and register. The link will be showing on our screen and we can get to be part of the conversation. You also spoke about healthcare as business. So
Mm.
in the Nursiscope Career Bootcamp, we have a track that focuses on entrepreneurship in nursing. So I'm encouraging our participants to connect and register and be part of the conversation. So we have another question on the screen that having noted that most families transit to the Western world based on sponsorship of the spouse who is into healthcare. How do you balance career transition with family dynamics?
Okay, so personally, I haven't really experienced a lot of this transition with family dynamics because I transitioned on my own.
Okay.
But I have seen, because I have a lot of friends who have kids and even younger kids, which is really challenging abroad
Uh,
because childcare is quite expensive. I don't know, Dr. Dami, if you have a family or you have
yes,
kids.
I do.
Yeah, so I'm
Yeah.
you're gonna test how expensive it can be.
Yeah.
Yeah, I've had conversations with his friends, and the way they did balance things is like, for lack of better words, is having a compromise. Uh,
Mm,
Most of the families, anyway, and I know it's not always like having husband and wife or like partners coming in with kids and stuff. Sometimes it can be a single parent coming in. Um, it's understanding what are the things that you can compromise.
mm,
So, for example, I have many friends, both nurses, husband and wife, or partners, nurses with kids, came to the US, but then because childcare is expensive, one has to give up bedside nursing and the other one has to work. What they did eventually was try to find, and I guess like this is a good thing about the West, um, is that there are opportunities for jobs that are work from home setup.
yeah.
So
Yeah.
some of them are like going to work and the other partner is staying at home, take care of the kids, while also doing some work from home stuff, or like they sometimes organize their schedule in a way um, that it suits them from a childcare perspective, because that's really the struggle most of the time. um, Another thing that I've seen too is the dynamics in terms of how you raise your kids culturally. It is so different here. At least what I can see from the Philippines and then US perspective. Like, I'm not saying that there's good or bad, but it's just that it's just different. And because of the differences, what I've seen many of my Filipino colleagues, and I'm saying this, from a cultural perspective, is that we really try to find opportunities to find our local communities. So we try to reach out to, Filipino groups or like church groups or something like that, that we can bring our kids so that at least, our kids can still play, or their kids, because I don't have a kid, their kids can still play with people of the same culture, people of the same background, people who can still speak their language. Because how amazing would it be that even if your child grew up here in the West, they can still talk, they can still speak your native language. Like for me, if I would be a parent, like I would be so proud that I was able to raise them, both in English and in my vernacular too.
Okay.
Um, so yeah, there's no like specific strategy in doing that, but I would say like compromise is one, finding the compromise that will suit both of you as partners if you have kids, and also finding the community that can help support you.
Yeah, that's really, really brilliant. And I can perfectly relate with what you have said about compromise. Looking at my story and journey when I was doing my PhD, and then my wife had to, cater to the family, and we had to balance things. And the place of community too is very, very important. I've also learned to ask for help.
Right.
Asking for help is really, really important. Thank you so much for sharing that. We are almost ending the session. Our time is fast spent, but we can take like one or two more questions. So we have a question around how to update or optimize LinkedIn. So please register for the bootcamp, and then you are going to have more opportunities to learn. There's going to be an hands-on section. Actually, we have the general live sessions like this, and we also have track sessions, which are breakout groups. That is actually a workshop focused. And then one of our facilitators will be helping with that. Another question coming around is, what are the chances of getting sponsorship in Western world to improve my nursing career after graduating from college?
Okay. I couldn't speak for like different nationalities or different countries because, and the reason why I'm saying this is that, and I can only speak for the U.S. And Dr. Dami, you can share your insights too, since you're
Okay.
based in Canada. So in the U.S., they have this so-called pathways for nurses when you come here. So, for example, I entered here via green card or an immigrant visa. There's also this H-1B or working visa for specialized nurses.
Yeah.
Um, so there definitely needs to be a sponsorship, but the sponsors then will determine whether they are okay accepting new grads or they want nurses to have at least a year or 2 or 3 years of
Yeah.
home country experience to move to the States.
Mm.
And Dr. Dami, like, I'm not so sure how it is in Canada, if it's the same.
Yeah, so in Canada, there are actually some opportunities for nurses to migrate, but actually, one needs to really fund some of these opportunities by yourself, and then we also have some provinces. Like when I was in Alberta, there was a program by the College of Registered Nurses of Alberta, helping IENs move to the country, and then they're able to in one way or the other support some parts of the transition. But I can actually say I remember too many years ago in the UK we had many nurses, many of my colleagues that moved to the UK and they were sponsored by various agencies. And
Yeah.
like I've also said in the US, I know people that various agencies also help them sponsor them to migrate. So I'll just encourage that person to try and research more and let's talk and we can link you with opportunities depending on the place that you are actually going. And one other thing is that migration is really expensive, so be prepared for that. Like Dr. Joseph mentioned, there are many financial implications which you might have to bear. So our last question for today is, people say to transition to other countries it must be through bedside nursing. You can't travel to other countries through non-bedside roles. Is that true, Dr. Arnold?
Not necessarily, but I would say the majority of the hospitals here would usually require bedside nursing. So if I have to be honest, like when I transitioned here, I started as the bedside nurse
Okay.
in the US. I did only work for a few months, less than a year, because I was able to find another teaching opportunity. But most of the time, the entry, at least for Filipino nurses anyway, is through bedside nursing.
Yeah.
That being said, if you have some specialty that the country would need and they don't have that resource in country, they can actually open up pathways for you. So, for example, Dr. Dami is a professor and he specialized into something. He can
Yeah.
actually move here as a professor
Mm.
because they need that and they don't have that resource here.
Mm. Yeah, that's really, really true. You don't, it's not only the bedside nursing that you can transition through. While that's the most common pathway for many nurses to migrate, I've seen nurses leave one country to the other through other routes. For example, I left Nigeria through a PhD sponsorship I got at the Chinese University of Hong Kong. And after I left Hong Kong, I also got the Alberta Innovates postdoctoral fellowship program, which sponsored my migration to Canada, right? So we have those opportunities, and a couple of my mentees to have gotten opportunities for scholarship. Some moved from masters to PhD in the US, and
Mhm.
some got sponsorship from BSc to PhD nursing in the US. And currently in Canada, we have a lot of funding that the government is providing for scholars. There are some thematic areas of research that have been identified in AI and some other areas. So scholars who are interested in this pathway why not? You can migrate to Canada through those pathways. You just need to reach out to a professor and we can guide you as far as that process is concerned. Thank you so much, Dr. Arnold, for this beautiful sharing. We are really honored to have you. Let's put our hands together for Dr. Arnold for this wonderful section. And we hope when next we call upon you, you will answer us and you honor our invitation. Thank you so much.
I just want to give you a shout out, Dr. Dami, and the entire team at Nursiscope for, you know, having this boot camp. I think like you're going to be helping a lot of nurses, and you're definitely going to be making a lot of impact for our nurses, especially those who are unsure as to where they want to go in their nursing career. So well
Yeah.
done.
Thank you so much, Dr. Arnold. Right. So we are about to end the program. For today, we have some announcements, and I'd like you to pay very close attention. When Dr. Arnold was speaking, he mentioned something very critical that in nursing school, there is really no program that helps you design your career. And that's why Nursiscope has organized this boot camp. We are really passionate about your career. We want to help you plan your career. We want to help you design your career. We want to help you move from where you are to the next level you are meant to be. So join us in this boot camp. This section is actually a free one, a free session for everyone. We have made the opening session a kind of session that everybody, regardless, can be part of. But subsequently, we are going to be proceeding to closed door sessions where we are going to be moving into the in-depth mentorship conversations, group assignments, one-on-one sessions and all. And those will not happen live on Facebook and YouTube. So if you have not registered, the opportunity is still open to register. Try as much as possible to register, and then you will be added to the group. We have a group actually where we are passing information, announcements, and that's very important for you to pay attention to. Also, we want to hear your key takeaways. Right, Dr. Arnold mentioned something very important that nurses can actually, be able to get opportunities through LinkedIn and all, So I'd like you to take the bold step to show yourself. You mentioned putting yourself out there. It's important for you to do that. So we'd like to hear your experience through the hashtag my Nursiscope experience, my Nursiscope experience. So let's try and talk about what you have learned. I know you have learned a lot of lessons, and there are many people out there that should know what you are knowing, and they should be part of what you are learning. And he also mentioned something that is very profound, that you should be a bridge helping others cross their bridges. So you are going to be helping others cross their bridges by also sharing what you are learning through this boot camp. Okay, so let's go on LinkedIn, go on Facebook, and do the needful by sharing information about what you have learned. And if you have also not subscribed to our YouTube channel, or this channel is rich, we have a lot that we are going to be doing. After this boot camp, there is a program we are also planning, so it does not end here. So we are going to be having a webinar some months after this boot camp on advanced practice nursing. You've heard us speak a lot about research, about nursing education, about teaching. So one of the next phases that Nursiscope will be going into is advanced practice nursing. We want to train nurses in clinical roles, nurses in roles like advanced nursing practice, nurse practitioner, doctors of nursing practice, and a host of others. We are going to be bringing various nurse practitioners across the world, from Hong Kong, from Canada, from United States, coming together on the Nursiscope platform. So you don't want to miss that information on our YouTube channel. Try and subscribe. Please like this live session. The more likes we get, the more YouTube is going to shoot our video out there. And also share this live on your WhatsApp, share on Facebook, share on different platforms, so that more people can learn from these. And for our registered participants, please pay attention to your email. We have various assignments for you. We have documents we are going to be sharing with you, and we would like you to not miss any of those information. information. So the next session is going to be next week, Saturday. This boot camp is from March to April, 8 weeks. 8 intensive weeks of mentorship, of training, of coaching. So next week we are going to be coming on board again. We have a scholar that is going to be, teaching us around the areas of winning scholarship, global opportunities, as we have heard today. And this scholar has won a couple of scholarships. Excuse me, herself, and you want to really learn from her how to do this. And for our registered participants, if you are in need of any one-on-one session, you have questions, you need clarity on, please reach out to the admin of the group, and we are going to schedule you for that. One good thing about this session is that it's not just going to be a group one, it's not just going to be a general thing. We are also bringing a one-on-one component to help people, get the information and the mentorship that they need. Thank you so much. See you next week. And we are glad to have you on board. There are also people who have reached out to us that they are not having much finances to be able to register. We also have a scholarship program where we are helping nursing students who are financially challenged to be able to, register for this program. So you can reach out to us. And if you are here or you are a friend of nurses, you love to support nurses, you want to help people who are not able to register for this program, like Dr. Arnold mentioned, that we should be a bridge, helping others cross their bridges too. If you like to help others cross their bridges and also being part of this program, you want to sponsor one nurse, two nurses, why not? Reach out to us, and the link is also showing on your screen, and you can help people be part of this mentorship journey. Until next week, Saturday, myself and other team members, we are really honored to have you. Thank you so much. Our technical team, the Nursiscope media team, led by Nurse Arolo Damilare and all other team members, thank you so much for all you do, and for the bootcamp committee. So thank you so much. See you all next week, and bye-bye.